In May, a 20-year-old student complains of pain in his right axilla for 5 days. On examination, his axilla shows redness and is tender over a 3 cm area. A. What is your suspicion? B. Give a sketch to manage his problem. Answers: A. Hidradenitis suppurativa. B. A course of metronidazole, a prolonged course of erythromycin. Avoid deodorant in the axilla. Keep the axilla hygienically good. If the condition does not respond, then surgical excision is necessary. If a wide area of skin needs to be removed, the wound needs to be covered by a split skin graft. A 24-year-old newlywed woman comes with a firm swelling on her left supraclavicular fossa. She complains of numbness and weakness during washing of clothes. On examination, this side pulse is weaker than on the right side. On X-rays chest, the surgeon discovered the cause of her problem and advised treatment. A. What the surgeon has discovered on X-rays. B. What is the treatment advised and how should he proceed? Answers: A. Cervical rib on left side. B. Before surgery nerve conduction study. Duplex scan subclavian artery or angiography is needed. The rib should be excised with periosteum, otherwise it will regenerate extraperiosteal excision of the cervical rib together with any bony prominence from the first rib. A 55-year-old farmer comes with a history of swelling around the left ear for the last 10 years. It has recently increased in size up to 18 cm, and he is unable to close his left eye. A. What is your spot diagnosis? B. What will you do to complete your clinical examination? E. Outline the management plan in 6 lines. Answers: A. Carcinoma left parotid gland with facial nerve involvement. B. Examination of the whole parotid gland, including inspection, bimanual palpation, bidigital, examination of duct, examination of the facial nerve, temporomandibular joints, and regional lymph nodes. C. Confirmation of the diagnosis by FNAC of swelling, CT scans of head, neck and face, MRI X-ray chest, USG abdomen. After counseling the patient and obtaining consent, the radical parotidectomy with neck dissection is performed. A 70-year-old elder from tribal areas of Pakistan has had a non-healing 1.51.5 cm ulcer on his right cheek for the last year. On examination, the ulcer has rolled up margins with no evidence of any swelling in the rest of his head and neck. A. Name 2 main suspicions of keeping a high index. B. Give a management plan of diseases you favor concerning any latest development in this field. Answers: A. Basal cell carcinoma, squamous cell carcinoma, wide local excision of lesion or radiotherapy. B. The latest development is Mohs micrographic surgery. A 12-year-old schoolboy is brought to emergency after a road traffic accident 20 minutes earlier. He has a laceration on his forehead, bleeding. He is fully conscious. A. What will be your first step? B. In 3 lines, give the next plan. C. Enlist a definite management plan. Answers: primary survey and resuscitation, airway, breathing and circulation. In this patient, the first step is to stop the bleeding by pressure dressing. Secondary survey, X-rays of skull and neck to rule out skull fracture and cervical spine. Injury. Primary suturing of laceration, appropriate analgesia and antibiotics. Tetanus toxoid. Primary suturing of the lacerated wound, with proline under aseptic measures, monitoring of the patient with Glasgow Coma Scale, and follow-up after 5 days for the examination of wound and stitch removal.